Hello everyone. We are in the worst part of the pandemic right now. People are not getting beds. There is a lot of requirement of oxygen, medications like Remdesivir, tocilizumab, plasma. There are Twitter messages, there are direct messages, there are videos people putting out saying that they need these medications, begging for help. So just we thought let's clear the air regarding these medications so that at least some sanity prevails during this pandemic. So just let's look at the role of Remdesivir actually in COVID management. So what exactly is Remdesivir? Remdesivir is an antiviral agent, okay, and it has been shown in laboratory experiments to be effective against this COVID virus. Even in animal studies, that is when this drug was tried in monkeys, it was found to prevent lung damage and also disease progression. So far so good. This drug seemed very promising. However, what is the evidence in humans? There are 5 major trials of note for Remdesivir. The first one, which was actually sponsored by the pharma itself, had around 1,000 patients, and it showed that Remdesivir decreased the hospital stay, say from 15 days to 10 days. However, there was no benefit in mortality. That was, it did not save lives. 4 more studies, most notable of which is a study done by the World Health Organization, which had more than 12,000 patients, which also included patients from India, showed that Remdesivir had no role in preventing deaths, or it did not even reduce the hospital stay. So you can see 5 studies, 1 showed positive benefit, 4 of them showed there is no benefit. So if you look at the role of Remdesivir according to the authorities, the World Health Organization actually recommends against use of Remdesivir. So there is because of lack of evidence. So all the studies done over the past 1 year, when these were analyzed in something called as a systematic review or meta-analysis, it was found that Remdesivir most likely had no effect on mortality. That is, it did not prevent deaths. It may have some role in preventing patients going on mechanical ventilation. So far we found that Remdesivir probably had some role in laboratory experiments, even in animals, but human studies actually showed very minimal or no benefit. Then why use Remdesivir? Why is this shortage of Remdesivir? That is because physicians are under pressure to use any medication because we don't have any cure for COVID. And this medicine, which they feel that let's use it, what is the harm in using it for whatever little benefit it might give. That is why this has been extensively used without actual benefit and no benefit in mortality. That is the bottom line. Remdesivir does not reduce death from COVID. It may actually only reduce the duration of hospital stay or reduce the chances of going on mechanical ventilation. It should be used only in patients who are on oxygen but not very sick enough to be on ventilator. So allow your physician or an intensivist to decide if Remdesivir is actually needed in your patient. It is not a magic bullet. It will not cure COVID, and it is not a life-saving drug. So I think you can now decide why this medicine has to be used only in some group of patients and not in all patients with COVID. Thank you.